So, in health and social care and many other sectors, we have a really diverse workforce, including many people from overseas, and that's something we should embrace, I feel. So today, I'd like to chat with Laura to find out what does that mean for a manager, and specifically in Laura's experience as a manager in social care, what does that mean around making sure people feel really welcomed and integrated into not just the home but the local area as well. So some things to think about for today's session. Laura, so there we go. You've got a very diverse workforce, which I believe is a really great thing and something we should embrace and harness. Um, so what does that mean for you as a home manager in terms of thinking about how we integrate people, especially from overseas, into your home, but not just the home, but I guess the local environment as well. But that must give you some things to think about and really focus on that perhaps you need to do on a regular basis.
Yeah, and I think it basically encompasses their whole lives. It's not just their working lives. You know, they're coming from overseas. They're having to adapt to a new country, new way of life, a new setting. A lot of overseas staff members have worked in hospitals before, but possibly not care homes. So it's adapting and introducing them to how we work, making sure that they're supported in work and out of work. You know, and that all starts with they've been recruited. They come along on their first day, making sure that they feel welcome and that they instantly feel part of the team, letting the team know in advance that they're coming on board so that they can welcome them. They can do a bit of research themselves on where they've come from. You know, what I've done in the past is we had some staff came from, I think it was Poland or Romania, and we made sure that we got the chef to make some sort of home cooked food for them, just to welcome them into the team, so that they didn't feel as if everything was brand new and they were having to adapt to everything in the one day. It's a gradual phase process, making sure that they're properly supported from day one.
Yeah, and I like that bit about kind of not just integrating them into social care or not just into the home, but actually kind of more broadly speaking, kind of integrating them into the country, really, I guess, and into the environment that they're going to be working in. Have you got some examples of when that's worked really well, and maybe some specifics there of what you did or what the team did to help overseas workers really integrate and feel at home? I think was the phrase that you used, feel at home.
Yeah. I had a couple of overseas staff who came on board, and I buddied them up with a couple of my experienced care team members, who then kind of took them under their wing. They took them to register with a local GP, and they introduced them to local community clubs for people from their country, because there already was an established community in the town. They helped them sort of go shopping. They helped them with the money side of things. They helped them open up bank accounts. They actually sort of took them right through all the basics, invited them round to their own house for tea, met their families, really made them feel part of the community. And we did a lot of things in the home as well. We didn't just have like a normal themed day, you know, sort of each month for a different place. We actually integrated their culture into the home, introduced them to the residents, let them speak to the residents about how their culture is and how it differed from ours. So we actually tried to make them very much feel part of the family. Yeah.
So, talking of feeling part of the family, it just got me thinking about actually. I've worked a lot abroad over my career, but I've never moved house and lived abroad, and then kind of worked there. So I'm thinking some of those real simple, practical things would be really, really valuable, wouldn't it? You know, people showing somebody how to register at the doctor, showing people the local area, connecting them with groups, and those kind of real practical things. I can imagine how that would make a real big difference in terms of how quickly I felt comfortable in the environment. And once I felt comfortable in the environment, I'd then start performing more quickly. Is that something that you see as a result?
Yeah, and I think, you know, I'm always mindful that a lot of people have come over on their own. They've left their husbands, their wives, their families at home, so they're lonely, they're homesick, you know, they feel isolated. So it's making sure that they're not getting into that situation, that there's always a contact for them. They've got the contact number for their buddy or for me or for the deputy, so that they can pick the phone up if they're just feeling a bit out of sorts. You know, and making sure that we have regular wellbeing check-ins, catch up with them every week. How do you feel you're settling in? Is there anything we can do to make things a bit easier for you? Are you comfortable? Are you happy? Is there anything you need that you're not able to get yourselves that we can help with? Signposting them to support services. They might need that bit of support, whether it's someone from their country who's also living nearby or working in one of our sister homes, putting them in touch with them, having that peer support for them, which means they don't feel alone and out of it, away from everybody that everything they know and love. It's making sure that they're not being overworked, because their tendency that I found over the years, because they're over here on their own, their families are at home, they don't tend to go out and socialise much, so they'll volunteer for all the extra shifts that are going, they'll pick up all sorts, and it's making sure they're not overworked and that they're recognised for what they're doing, and they are having protected break time and days off, and making, thanking them for offering, but saying you need some time for yourself. Let's organise something, make sure you're off the same day as your buddy, catch up and go out for a day, and just making sure that their overall general well-being has been looked after and not just their work rota and their shifts.
Sure, and whilst well-being is a major part of any management role, or with any member of the team, but I can see how having a really kind of clear focus on broader well-being, more holistic well-being for our overseas workers is really beneficial, and it makes perfect sense, doesn't it? If somebody doesn't feel safe, they don't feel part of a community, like say maybe they're over here on their own. I can only imagine how that might feel if it doesn't work out too well. So making them feel comfortable and safe is kind of the first step to them high performing, really. And I know that you've worked with many overseas workers who have been exceptionally good, haven't they?
Absolutely. Some of my best staff have been overseas workers. We've supported them through their training, supported them with adapting, and and bringing some of their culture into the home for them, so that our team learn how their culture is and what they do and how their sort of normal day would go. We all bring in meals, we all cook from our own. I'll bring in something Scottish, we've got Welsh people bring in something Welsh, and we all bring in our own sort of cultural dishes and we share, and it really breaks down the barriers and builds that bond. And then we have cooking demonstrations. We've all cooked for one another, and we'll do it in the home with the residents involved, so that we can see how to make their dishes, because some of the dishes that they bring are phenomenal, and then it's talking about their country in general, and it's a bit of a learning session for the team and the residents. I've had a lot of the overseas staff have sat and spoken to the residents about where they live and what their country's like or what their city's like.
Yeah.
So it actually works both ways.
Yeah, and I can imagine it creates a really kind of rich learning environment. I guess not even to do with work, just as human at a human to human level. We're learning more about different people from different parts of the world. I think that can only be a good thing.
Oh, definitely. I mean, every single person has got their own skills and attributes, and just because someone's from overseas doesn't mean they don't have skills and attributes. Some of them are highly skilled, and I've learned from quite a lot of the overseas team that have come over, and I know that my staff team have embraced it, and they've all said that they've learned loads and that they really enjoy working with such a diverse culture in the home.
It sounds fantastic. I guess in terms of bringing it down to maybe your top tips, what would be your top kind of summary words of advice then around how to integrate overseas workers into the home so that they feel safe and secure and can perform really well, integrate into the home and really kind of contribute to that diverse environment?
I think the most important thing is to have regular catch-ups with them. At the end of day one, how did your day go? Was everything okay? Did you manage to find what you needed to do? Was everyone okay with you? And then do that on a weekly basis for at least the first couple of months, until they feel that they're settling in and they feel part of the team, and making sure that you keep the team updated as well. If you see that somebody's struggling with something, signpost them to someone who would be really good to take them under their wing and support them and help them with that. It might be a training issue, it might just be something that, because it's culturally different, they have to adapt slightly, and it's making sure that you know who to pair your overseas workers with.
Buddying you talked about.
Yeah, absolutely.
Yeah. Okay, fantastic. Once again, thank you very much. Very insightful.
Thank you.